Good evening and welcome to TMJ4 News at 6. An old drug is resurfacing in a new way right here in Milwaukee.
Yeah, Rebecca Klopp goes in depth tonight on the concerns about meth.
A drug that the Milwaukee County Medical Examiner's Office had rarely seen in overdose deaths in the last decade is now showing up at an alarming rate.
Jessica Perbilski never thought she would try meth, let alone become addicted to it. But the mother of two says that's exactly what happened, and meth proceeded to steal everything from her.
It ruined everything about my life. I lost my kids, I lost myself, I lost my job. Basically threw my college degree out the window.
Jessica lives in Chippewa Falls, an area that has seen an alarming number of methamphetamine cases. She tried the drug for the first time 10 years ago to help cope with the death of someone close to her.
I was having a hard time, and here this is going to make you feel better, and you won't think about this anymore.
After that first use, Jessica told herself she could do it just on weekends or at parties, but it quickly spiraled. Jessica shared these mugshots with us, wanting people to know this was how she looked when she started using. And over the years and the arrests, she says she lost weight, teeth, and the people she loved.
I lost my family. I didn't talk to my brother for probably 4 years.
The Milwaukee County Medical Examiner's Office says between 2006 to 2016, there were a total of 5 overdose deaths from meth. Most of the years, there were none. Since 2017, there has been at least 50 cases. That's a 900% increase in just 5 years.
We are seeing quite a bit of methamphetamine, and that unfortunately is also being used in combination with fentanyl or another opioid. So that incidence is definitely rising.
Just this year, 8 people in Milwaukee County have died due to overdosing on meth. The drug is suspected as the cause in 22 more deaths. That's almost the same total as all of 2020, and we're not even halfway through the year.
There are a few things that contribute to that. One seems to be that as people stop using prescription opioids, they switch to illegal substances, and meth may be one of them.
Wisconsin Attorney General Josh Kaul says the meth being used in Wisconsin right now is being brought in from out of state.
Meth seems to be primarily being trafficked right now from other countries into the United States, and it could be sent through the mail, for example. In northwestern Wisconsin, a lot of it comes through Minneapolis. In southeastern Wisconsin, Chicago may be a more likely route.
The director of addiction services for Rogers Behavioral Health points to the pandemic as part of the reason meth is now in areas it wasn't before, like Milwaukee County.
We've seen an increase in some substances while a decrease in others. So methamphetamine tends to be...
Michelle Maloney says many people use meth for the euphoric feeling it gives them, but she says it also causes real mental health issues as well.
Because of the way it interacts in your brain, it also creates impulsivity. So individuals tend to be admitted into psychiatric hospitals under mental health reasons.
For Jessica, who now works with people who are trying to get off meth, she says she knows why it's so attractive.
I think it's cheap, for one.
It took multiple attempts at quitting, including doing a drug court recovery program in Chippewa County and a long-term inpatient treatment before Jessica got off meth. She is now 5 years clean and makes it her mission to warn others about the dangers of using meth to deal with a hard time in your life.
It's not worth it. There's so many other options.
If you or someone you know needs help with addiction, you can call the National Substance Abuse and Mental Health Services Administration. We have a link to their number on our website. Reporting in Milwaukee, Rebecca Clough, TMJ4 News.